So welcome everyone to the Health Workforce Council quarterly meeting. This is our September meeting, and I'm Haley Mears. I'm the Workforce Development Program Manager at the Health Improvement Partnership. And with me is Maria Gerizano, our Program Coordinator, supporting our workforce efforts. So we'll go ahead to the next slide.
So hi everyone and welcome. As Haley mentioned, my name is Maria Gerizano. I am a program coordinator at HIT. So to just get us started, if we can have everyone please share in the chat your name, your title, and the organization you're with today. And if you can also please share any interests or projects in health workforce development that you are participating in.
Feel free to drop that in the chat, introduce yourself. We'll also put the prompt in the chat for any latecomers. I apologize, my cat is joining me today as well. So I tried to lock her out of the room and she was not happy about that. So quickly say hello, Gracie, to everybody, since you want to be here. All right, little pet love this morning. Moving on to our next slide. So I just want to go over our agenda for today. As mentioned, please introduce yourself via the Zoom chat box. We'll put the prompt in there shortly for any latecomers. And then we have engaging presentations today. I'm really excited that we've got Connie Williams with the Watsonville Santa Cruz Adult Education Program presenting on the new Home Health Aide program. And then we also have one of our Health Workforce Council partners, Workforce Santa Cruz County, will be presenting on business services and resources that they provide to healthcare organizations. So excited to have these two presenters today. Nathan Koo will be doing that presentation. And then we'll wrap it up with our Health Workforce Council updates, and we'll share some specific updates to each work group that we've been convening over the last quarter, and share information about the High Road Training Partnership Grant that HIP was awarded. That grant is now, we're in contract with that grant, so we'll share kind of what it's going to look like for the next 3 years with us working under this grant. And then we've got a closing with some really important save the dates and announcements, so please, if you can, stay on for the full meeting. If not, we'll be sure to share those updates in a follow-up email as well. So next slide. So with that, I'm going to jump right in. I want to introduce Connie Williams. She's the CTE Program Director and the CNA Program Director at the Watsonville Aptos Santa Cruz Adult Education Program. So Connie, welcome and thanks for presenting with us today.
Hi, good morning, everyone. My name is Connie Williams, and that's right, I am the CTE Program Director at Watsonville Aptos Santa Cruz Adult School. And here's my contact information. Please feel free to contact me at any time if you have any questions or concerns at all. I'm happy to answer, and I answer usually within 24 hours, sometimes sooner. Okay, next slide. So first, I just want to talk about why it's important for us to have home health aid programs in our county. So a home health aide is somebody who goes into someone's home and they care for other people. So patients are actually a lot more comfortable in their home compared to being into like a long-term care facility or even an assisted living facility. Most people would prefer to stay in their home as long as possible, and home health aides make that possible. And then having a home health aide and having home health services, which includes a nurse and physical therapy, it decreases the number of repeated hospitalizations because signs and symptoms are caught earlier. So, I mean, it's just, and they are better treated. So for example, let me tell you, if someone's in a facility, like an assisted living or long-term care, they're subjected to all the diseases that everyone else has at that facility, and that makes them more likely to catch an infection. Home health care is less expensive than living in a facility. Facilities are actually very expensive. And they receiving care at home preserves the dignity of individuals. It's not uncommon to have people in a subacute facility or a long-term care facility sharing their room with 2 or 3 other people. And that's not great for preserving your dignity. You can hear everything that's all the other patients in the room can hear what's going on with you. And although the people who work there try their best to preserve confidentiality, it's very difficult when there's just a curtain separating you from other people. So home health does offer a lot more dignity for individuals. And home health aides, well, if you see that, and those initials, HHA, they're called home health aides. They work with physicians and physical therapists, occupational therapists, speech therapists, nurses, and all those people come together with the patient and their family to create a holistic plan of care. Okay, next slide. So I got these statistics from the California Legislative Analyst Office, and they said that there's going to be a huge need for home health aides in the future. This graph goes from 2015 to 2060, and it will say the growth in the senior population will far outpace the growth of those people who are under the age of 65. Primarily, that's related to the baby boomers and the children of the baby boomers, which goes until the baby boom, I believe, goes until mid 1960s. And so those people are starting to hit 65. So 1 in 5 people over the age of 65 are also living longer than was expected back in the 1950s and 60s. They have a 70% chance of needing a home health aide, and a 1 in 5 chance of needing their services in the next 5 years. So the number of people, and also it's not just people who are elderly or over 65, I should say, who need home health aides. Also, people who have been in accidents or people who are living with disabilities also need a home health aide from time to time. And so it's expected that the number of home health aides needed would be significantly higher, because there will be 2.7 million people living with disabilities by 2060. But so if the population of those people under the age of 65 by 2060 is significantly smaller, there won't be enough people to take care of people at home. So we need more home health aides. Okay, next slide. Here's an occupational profile that I got from the California Employment Development Department, and they say that there will be a 19% change of total job openings needed, estimated, and this is between 2018 and 2028. I think the number is probably going to be higher, but you know, I don't know where they get their statistics from. Okay, next slide. This is a slide that has a lot of words on it, but I have it here so I can explain to you. There's different words for some people who come into the home to provide care. And I would like to start at the bottom where it says in-home support services, the bottom left-hand corner. So that's a IHSS. Some people have heard of that before. That's administered by the Home Care Services Bureau. And so they need very little training to become an IHSS provider. They do need some, but it's not very many hours. Other people can go and be a home care aide. They're unregistered, meaning they have not registered with the state of California Department of Social Services. They have not received a live scan, so they're not necessarily recommended by the state. It doesn't mean that they're bad. It just means that maybe they have a criminal background or they just don't want to register with the state. They're still good personal caregivers, but I mean, someone who's looking for someone that they if they're looking for someone they can really trust, they might want to look for someone who has registered with the state. And so we have the registered home care aide who's independent. They only need 5 hours of training. That's a personal care assistant. And then next, going up the scale on the left-hand side, we have the registered home care aide who's affiliated with some agencies, like there's some in our area, and they are actually registered. They have a live scan, and the agency sends them out to people's homes. They're not home health aides. They are caregivers. They can also work in assisted living facilities. And then finally, home health aide. These people are certified nurse assistants first. Okay, so there's 2 ways to become a home health aide. You can take just a standalone 120-hour program and become a home health aide, or you can take a CNA program like we offer at Watsonville, Aptos, Santa Cruz Adult Education. That takes 160 hours. CDPH regulates this, and then they take 40 additional hours, which is also regulated by CDPH. So that's actually a total of 200 hours of training. This is significantly more than all of the other caregivers. They go into great detail during these courses about how to care for people with different diseases, different disabilities. Okay, next slide. So the federal government a long time ago decided that they passed legislation and that they would have home health aides trained and evaluated through approved training programs. And each state is responsible for ensuring that these regulations are followed. And so the California Department of Public Health is who regulates home health aid agencies and home health aid training programs. And Watsonville, Aptos, Santa Cruz Adult Education recently received approval from CDPH. And so now we're able to offer the class. Okay, next slide. So we will be offering a home health aid class, and we would like to get the word out to as many people who as we can and who may be interested. Our first class will be in January. It's a 40-hour program. It will happen at our campus. It's on Green Valley Road. It'll be on January 16th through 18th from 9 a.m. till 4:30. That's a Tuesday, Wednesday, and Thursday. And then the clinicals will be at Pacific Coast Manor on a Monday, Tuesday, and Wednesday, January 22nd through the 24th. So it's just the next week. And that's 40 hours. The requirements to join the class are that the person has to be a CNA already. They have to be 18 years old and older, a high school graduate, or they could have a GED. And it costs $350. Okay, next slide. This is our teacher. Her name is Kathy Bautista. Some people may know her on the call. She's been an RN for over 40 years and worked in many different specialties. But the specialties that she's worked the longest for have been a home health nurse. She also worked for Hospice of Santa Cruz County. She's a certified rehabilitation nurse. She's worked with AIDS patients, and she's done post-op recovery nursing. She's also fluent in Spanish. So if there's any students who are transferring in and they're still learning Spanish, she could be very helpful with that. She has been teaching in our school the CNA course for 1 year now. And she also taught a caregiver course for 2 years. So she's a wealth of knowledge, and she actually teaches me things a lot. So she's great. Okay, next slide. I have a quote here from a student. I spoke to her on Monday night. This is what she said. "I help people through the worst time of their life, but I love my job. I help families learn how to take care of their loved ones. Although it is painful when a patient passes away, my job is so rewarding. I have learned so much about myself. Working as a home health aide has taught me how to provide care compassionately. I have learned how to give love without expecting anything in return. So I was really impressed with this student's comments, and I wanted to put that into my slideshow just to share with you. This student is a home health aide, and she also specializes in hospice patients. Okay, next slide. Also, I just wanted to mention that we do actually right now have a hospice aid course, which meets on Monday evenings from 6 till 8 p.m. now through December 4th. It's still available for enrollment. It is created for both caregivers with no experience. So it's actually a hospice aid / caregiver class. Or it could be also interesting for people who are already certified nurse assistants, because they can receive a national certification. And being in a class like this helps. You get to participate and learn from other students, and you're committing yourself to excellence in your area of expertise. And the class will provide a comprehensive review of the current body of knowledge of hospice and palliative care. So this class is both, like I said before, I just want to reiterate, classes both for CNAs and for inexperienced caregivers. They both have a lot to learn. The CNAs can take a national certification. All right, next slide. I think that may be the last slide. Yeah.
Yeah, thank you. We can go back one slide. We have time for questions for Connie. If anyone wants to unmute, raise your hand or put a question in the chat. And I had one question. I noticed that for the home health aid course, so students have to already be a registered CNA. Is that correct?
Yeah, certified nurse assistant. Yes.
Could you briefly just go over that program that the school offers for those who might not be familiar with that program? Because that's like the entry point to becoming the home health aide.
Yeah, so we offer that class at our school. The class is actually already in session right now and it's full, but we will offer it again in the spring. And we're recruiting students right now for that class. That class will take a student who has no experience in caregiving at all, and we'll take them all the way from the beginning. And for 60 hours, we will teach them the theory that they need to know to pass the knowledge exam, which is like a computerized written exam. And then we also have a skills lab at our school and at the 294 Green Valley Road. And we have mannequins and we teach them the skills. And when we feel like they're ready, we take the whole class to Valley Convalescent, and then they spend 100 hours there. So it's like 17 days, 17 clinical days to and they're paired up with a CNA, and they learn a lot from each of those CNAs about how to care for people in a long-term care facility, or it could be a subacute facility. So it's really the foundation and basis that people need to come to the home health aid program with.
Thank you. Any other questions for Connie? I'm seeing questions in the chat about whether there are scholarship or financial aid opportunities for students to waive the $350 fee. And I know you can answer that, Connie, but I also think our next presenter will be able to provide some information about that as well. So, but yeah, any other information about scholarships, financial aid for that $350 fee?
Well, we are looking to, well, actually, in order to qualify for WIOA funding, you have to have your program has to have already been going for 1 year. And so we wouldn't be able to access those funds. We may be able to find funding somewhere else. And I would be very interested to hear the next speaker about where we might get that funding. Yeah, we're looking for that information as well. I don't have anything to tell you right now about that. Julie Madrona said Kathy is very attentive, kind, and dedicated. Yes, she is. $350 can be a barrier for some young people, well, for many people. And I mean, sometimes we can work with Department of Rehab if they qualify there. If they are on unemployment, sometimes we can access funds. And sometimes if they have EBT or SNAP, we can access funds from them as well.
I will keep my eyes out too for any grant opportunities to maybe fund scholarships for this program to help support it. Or
Great.
maybe there's an employer who has a bucket of funding that they want to hand out to help train home health aides in our county. So I'm thinking of hospice or other organizations that could, I mean, $350 isn't that much to a large organization, but it's quite a bit if you're, a young person trying to live in Santa Cruz County.
I
So
agree. Yeah, I will ask hospice and find out if they might be offering some scholarships. I'm sure they would love to have those students work for them.
Great. Any other questions for Kathy? I've also seen some comments coming in about CalWorks, funding opportunities. I think if there's no further questions, and again, if something else comes up, as we're going through the presentation today, feel free to drop your questions in the chat. We'll go on to our next presenter, who I think can help shed maybe a little light on some of these funding opportunities. So I want to introduce Nathan Koo, who is the Business Service Manager with the County of Santa Cruz Workforce Development Board. And Nathan, are you there? You're on, we cannot see you, but I can hear you. So I don't know if you
I am here. I apologize, guys. I'm kind of in between meetings on the road right now, so I'm just trying to conserve bandwidth right there.
Okay, no problem.
Happy to still be able to present via cell phone, through a cell phone. So I'm seeing the screen right now, so I apologize if it takes me a little time to look at it. But good morning, everyone. My name is Nathan Koo. I'm the Business Services Manager for the Santa Cruz County Workforce Development Board. My boss directly is Andy Stone. He is the Workforce Development Director. And I'm at the bottom right there in case you guys need to know. We'll go into the next slide, please. So a little bit about who we are. So we are a county-led organization, the Workforce Development Board, and we are funded by the county. And through that, we get our funding from the federal and state government. But we are directed by a board of about 22 people. And these 22 people are community stakeholders of different organizations and business owners, and they kind of help us set the agenda on what we want to focus on every single year. So for example, one of the big things is one of our missions is to increase the quality of jobs in our communities in Santa Cruz County and just create new pathways and partnerships. Next slide, please. So a little bit about our services. Normally when we work with employers who are our clients, this is kind of the list of services that we provide. So on the job training, where we're able to subsidize up to 50% of wages, up to 10% or $10,000 reimbursed, depending on how you want to get employees into your organizations, we can help facilitate that. Youth work experiences is kind of like our paid internship program where we expose the next generation into different industries, in particular, kind of like the STEM and healthcare field. So we engage employers all the time to try to nurture the next generation on there. Layoff aversion is kind of on the opposite end of the spectrum when times of tough, the economy's getting tough and we're seeing layoffs come through. We help employers engage the employees and offer new training programs where, hey, if there's a promotional opportunity down the line where we can help skill you up to get you vertically promoted to prevent a layoff, with the understanding the employer kind of like backfills the position within 6 months, we help expand the capacity and keep jobs employed in the current employer. And then inevitably, if that does happen, if we do have employers who have to let individuals go, we set up temporary jobs to help people land on their feet and get them back into the workforce. And all this is kind of stipulated around funding for that year. Our funding is kind of dictated by the formula by the state. So earlier I heard a little bit about funding resources and opportunities. Normally, on a given year, we do have opportunities, if it makes sense, under the WIOA funding to be able to link up programs to say, hey, if there's a $350 barrier, let's see how we can match this up to alleviate that burden and cost. Unfortunately, this year we fell into it's a weird situation where when you're doing well, right, we get less funding, which is it's a funny place to be. And unfortunately, we got our funding kind of reduced this year, but we're happy to continue the conversations to set up the new pathways in the future, especially in the healthcare industry. At the moment right now, what's of most value that we've been providing our employers is the labor market information. So if there's any demographic or data or workforce needs or any industry needs that people need to understand of what's going on in the community, we do create reports to those employers. And then we also create intersectoral partnerships. HIP is one of our favorite ones right here, and Haley's been helping spearhead that. And it's been actually so successful, we're trying to like replicate it in other areas, like working with the city of Santa Cruz in the construction industry and creating like future sustainable partnerships of getting people employed into those industries. And then finally, our final service that we provide is rapid response. If in the case that employers have to let individuals go, we will show up with all our community partners to be able to provide resources on how to help those individuals transition, let them know what their benefits are, and how they can land on their feet and how to get back into the workforce. Next slide, please. And this is an example of kind of one of the reports that we provide is every year we provide the Santa Cruz County State of the Workforce. I have the link for you at the bottom right there. And just a quick highlight this year that we focused kind of a little bit on the healthcare sector earlier. According to the Bureau of Labor Statistics, we know that from 2020 to 2032, it's going to grow about 15%. So we are very, very invested in helping this industry grow. And if we go next slide, please. And with the help of Haley here, these are kind of like healthcare by the numbers. We know that in our county, right here in Santa Cruz County, 14 out of every 100 jobs are healthcare sector jobs. And within even the last year, we've had about a 5% growth. So there's a large demand going on right now. And when we meet at these kind of convenings that are held quarterly by HIP, we're helping kind of meet those demands of people retiring or just demands of the workforce. And these are the kind of jobs that we need because we're seeing that the average healthcare job is about $76,000. And those are kind of the kind of jobs that we're trying to create there. Next slide. And in the past, my predecessors have had the opportunity to work with some of our other businesses here, Driscoll's, Poly when they were around, Sutter Health, and Dominican Hospital. So we have engaged with these individuals and we're always open to new partnerships. So if you're interested in creating new pipelines, feel free to reach out through me or reach through Haley, and we're happy to continue the conversation. Next slide. So this is your invitation. This is our full board right here. I just stepped out of the full board meeting, so that's another reason why my video is not on. But these 22 people here, they meet and they help direct us through how to help the employers and how to create new jobs in the community. And then final slide is kind of our contact information slide. So if you ever have any questions, you're always welcome to come down to 18 West Beach Street, Watsonville, visit our website, or just email me directly. And I'll be happy to set up a meeting or meet you in person to continue the conversation. And if you scan this QR code, it takes you directly to our link trees through some of our programs. And that is it. Are there any questions?
If anybody has questions for Nathan, feel free to drop them in the chat, raise your hand, or just feel free to unmute. I love that we get to partner with Workforce Santa Cruz County, and a fun thing Nathan and I just did earlier this month was we co-presented on the Santa Cruz County Health Workforce Council, the collaboration that Workforce Santa Cruz County and HIP did to get the council up and running. And we presented in Monterey at the California Workforce Association Meeting of the Minds in Monterey conference. And I have never I've presented at conferences quite a bit, but I have never presented at a conference where our session was fully booked, our attendees were fully engaged, and when we went to our Q&A session, we had like a half-hour discussion of Q&A and brainstorming with the group. It was really phenomenal. So that was really exciting to see that people all across California are really excited about the work that we're doing in our Health Workforce Council right here in Santa Cruz County. And it's kind of a new model for other regions to consider. And so we're very innovative in the work that we're doing. And that's also really made possible by all of you attending our meetings and presenting with us and attending our work groups. So anyways, thanks, Nathan, for presenting. Any questions?
I do see a couple questions in the chat right here from April. April, you asked if there's any involvement at Dominican Hospital right now. At the moment, there's nothing at the moment, any partnerships, but I'm happy to look into and explore that if that's something of interest. And also someone asked, Julie, you asked if anyone can join the board. I'm pretty sure if you're a community stakeholder, we're always welcoming people to be able to interview and join our board. You can always be a guest and see how we conduct ourselves. It's a pretty fun group and everything. But yeah, let us know. We have a great breakfast.
Any other questions for Nathan? All right. Oh, how do we be a guest? How do you join the board meeting as a guest?
Yeah, feel free to email me. My contact information is at the very bottom right there. Or if you just take your phone and scan that QR code, you can get directly contact with me. And I'm happy to put you on the invite for our next quarterly meeting.
Great, thank you.
You're welcome. Thank you.
All right, if any other questions come up, just feel free to drop them in the chat or you can email Nathan directly. So moving on to our next slide, we're going to share some just updates on our Health Workforce Council for the last quarter. So we're reviewing updates from July through August, and you can go ahead to the next slide. So our Health Workforce Council work groups, we have done some modifications to these work groups. Our previous group was called Behavioral Health and Health Social Worker work groups, quite a mouthful. What we decided to do was integrate the workforce topic into the already existing Integrated Behavioral Health Action Coalition group that convenes quarterly through HIP. So we didn't want to duplicate efforts and overburden partners. So we thought, why not utilize that existing group that's meeting on a quarterly basis, and then we kind of have a sub-meeting monthly around workforce topics within that workforce track. And the most recent update that I'm excited to share is that through the work group conversations and identifying barriers to providing associate level supervision, which is very costly and time consuming, we started collaborating with a group called Motivo Health that does online supervision. It's an online supervision platform. And so they've worked with us on providing our community a 25% discount on hourly supervision rates, specifically for organizations in Santa Cruz County. We've got about three, maybe four organizations that have signed up. And the good news is that's now approximately 19 associate level clients that are being supervised and helping us to increase our workforce in behavioral health in Santa Cruz County. And there's still an opportunity to join in on this discounted rate for supervision. So if you're at all interested, please email me and I'll connect you to the team at Motivo. They're super friendly and fun to work with, and they're still open to accepting organizations to join in on this discounted opportunity. Our Monterey Bay, our medical assistant work group has put together an externship best practices guide. It's available on our website, and we'll drop the link in the chat to our workforce webpage. And we're also wanting to engage more employers to help inform the transition from medical assistant externship from the classroom to careers. So we encourage more employers to join us in this work group. I have another slide. I'll talk about that in a couple of minutes. And then our Monterey Bay Community Health Worker Collaborative. This was our Community Health Worker work group. We've renamed it because we wanted to be more inclusive to Monterey County, who has been joining us on these efforts. And so this group was Cabrillo College was awarded a California Community College California Apprenticeship Initiative grant That's $120,000 for planning community health worker apprenticeship program. And we're partnering with them and supporting that effort as an advisory committee in the collaborative. You can go to the next slide. I also want to share within our Monterey Bay Community Health Worker collaborative, in August, we did a public proclamations at the Board of Supervisor meetings in both Santa Cruz County and Monterey County. They were on the same day to acknowledge and recognize community health workers, the importance of them in our counties, and acknowledge National Community Health Worker Awareness Week. So there's some photos here of myself and Adrian Saxton, who is with Cabrillo College, running the community health worker program there, and the proclamation that we read. And then the Monterey County Board of Supervisor meeting was actually recorded. And so we'll share a YouTube link if you want to watch that recording. The community health workers were actually able to stand up and do more of a formal presentation of their proclamation, which was really inspiring. Next slide, please. I think Cal is on the line. Do you want to unmute and speak about the primary care workforce work group? I'm putting you on the spot, but
I'm happy to talk, but you can add anything that I may omit. So our primary care workforce work group name got changed from pediatric care workforce, in that we are expanded more to primary care, primarily advanced practitioners or physicians in pediatrics and family medicine. But it's broadening that a bit, and we started just last January. We've worked through June in terms of, I think, addressing most of our deliverables. At this point, we're focused on going a bit further, both looking at the nurse practitioner program out of UCSF, and also the physician assistant program out of Monterey Bay State University, just to get them to come in and tell our story. We're also focused on looking at recruitment and retention. So the reality is that there are less and less pediatric and family medicine doctors graduating, and advanced practitioners, and more going into the specialties. And our community is competing with everybody else in terms of trying to recruit. And so the question is, how do we get them to come our way? And we have the good fortune of having the family medicine residency program coming out of Dominican, and so that we have potentially some pipelines in the future. But in the short run, a lot of our different organizations are challenged to recruit, and so we continue that work. And we're glad that we can continue to partner with Haley. So Haley, I don't know if you want to add anything else on that.
no, that was a great overview. Thank you.
Thank you.
Our surgical technician work group, this work group isn't really formally launched yet. We are waiting for, we're working on collaborating with an organization called Futuro Health. They have a sterile processing and surgical technician programs, and they're gearing up to launch their surgical technician program this fall. So in an effort to support that, we hosted an info session in April with them to provide information about that program. We did a strategic mapping session in June with some key employer stakeholders and Workforce Santa Cruz County. And the next step in this progress is to plan an event that will announce the launch in fall, and HIP will be hosting that. So check your email for an invitation to join us if you're at all interested in helping support the surgical technician pipeline in Santa Cruz County. As you all know or may know, there's no current training program right now. So we're excited to move forward with this effort as well. Next slide, please. So our Santa Cruz County Nursing Council, again, putting someone on the spot, but Anna Sutton, I see you're on the call. Do you want to unmute and share a little information about this group?
Sure. Thanks, Haley. Hi, everybody. Our Nursing Council is as a subcommittee of the workforce in general. we've been meeting for about a year, a little over a year. And it's nursing. I shared this with the HIPC Council. Nursing can be one of the most complicated and confusing healthcare professions to enter because there's so many different levels of licensure and so many doors to walk through, and you can shift every step of the way. So one of the first things our council has been doing is to actually just assess and take a look at all the different sectors of nursing and all the levels of nursing here in Santa Cruz. And so meeting and connecting on these monthly meetings, thanks to HIP's convening, has been really, really a critical first step to just assess that landscape of nursing here in Santa Cruz before we even take any further action. But right off the bat, something that we really learned is, and this is no shock to any healthcare workforce leader here, our healthcare workforce is exhausted. We've been fighting a lot of burnout, moral distress, moral injury. And so we're so fortunate to have 1440 right here in our backyard, and they're Healing Our Healthcare Heroes program. Thank you to HIP and to funders, Kaiser Foundation. We actually were able to send a cohort of 50 nurses to a Healing Our Healthcare Hero nursing focused weekend. They designed the curriculum at 1440 to be targeted at nurses. There was nurse messaging, helping nurses ground back into our whys as the beginning of addressing some of the moral injury and burnout. One of the big things our nursing council wants to do is keep what we have. We just need to maintain our nurses here. We know that the experienced nurses that we have are going to be the educators, leaders, teachers, and administrators for our future pipeline. So a lot of the work you're going to see in this next coming year is going to be about just getting our own house in order, getting our own story ready to tell about nursing in Santa Cruz so that we can actually make some actionable recommendations and take some actions in the spring. Thanks, Haley. Back to you.
Awesome. Thank you. And if I didn't properly introduce, Anna Sutton is a co-champion with Joe Cafaro on our Santa Cruz County Nursing Council. And then Dr. Cal Gordon, who just spoke previously, he is our champion of our primary care and pediatrician work group. So all of these work groups are facilitated by an expert in the field, and HIP helps facilitate and convene logistics of all the meetings and deliverables. So we're really happy to have partner engagement and support and thought leadership in all of these work groups. And if you want to join a work group, I just dropped my email in the chat, and you're welcome to reach out and let us know if there's a way you want to engage with us. Thanks, Jennifer, for the nice comment. Okay, next slide, please. I'm going to, so just to recap, the engagement opportunities where we're really seeking more engagement is our medical assistant work group. Cabrillo College will be hosting a fall CTE, that's Career Technical Education Advisory Committee meeting, October 11th at 10 a.m. It's a virtual meeting. It's 1 hour, and we are looking for more employers to engage with us to provide feedback on that classroom to career pipeline. If you're interested in participating in that, please email me and we'll forward you the invitation to join us. And then again, our surgical technician work group, we are looking for more employers to engage with us on placements and opportunities to upskill their workers and grow a local pipeline of surgical techs in Santa Cruz County. Next slide. We were able to present the Health Workforce Council, the work group updates, and had a really engaging presentation and conversation at the last HIP Council meeting. So just want to thank Anna Sutton and Jasmine Najero for presenting. You can kind of see them in the photos here. And I just want to let this group know that all of the work that you are doing under the Health Workforce Council and the work groups is being highlighted and acknowledged at our HIP Council meeting. So that's our team at the bottom. We went and got some breakfast after because it's a morning meeting. So we're going to keep doing this work for the next 3 years and keep updating HIP Council and the community on the important work we're doing around health workforce. With that, you can go to the next slide, please. So I'm going to shift gears and talk pretty briefly about our High-Road Training Partnership Resilient Workforce Program grant that HIP received. Next slide. We applied for this grant and we are funded now for the next 3 years to continue the work of the Health Workforce Council. So we're super excited that our work doesn't end this year. We're going to be continuing through March 2026. Next slide. The deliverables for this grant, it's really a facilitation and convening grant. So HIP as a convener will be doing our Health Workforce Council meetings. Those are quarterly, so we'll be hosting 13 of those. We're facilitating and convening 50 to 75 different work group meetings. All of the work groups meet monthly. And then we'll be hosting 2 annual community forums. We just did our HIP council meeting last week, so that also counted as one of our forums. And then we're attending professional development conferences to share out the work that we're doing. So as I mentioned, Nathan and I were able to present this month and share the work that we're doing for the Health Workforce Council and the grant that we received. And then Adrian Saxton with Cabrillo College and I will be presenting in October at the California Community Colleges Association of Occupational Education and sharing out a similar style presentation about the Health Workforce Council and the collaboration and partnership that we're doing across Santa Cruz County. The Health Workforce Council is the same as HIP's, well, we don't call it Health Workforce Initiative, we call it Health Workforce Council. So I don't know if that's something else you're referring to. Next slide, please. So the deliverables also include our 2023 workforce report and recommendations. That report's actually done. It's posted on our website. I think we've sent out a press release if you want to review the recommendations that the work groups put together. Basically, we looked at the data of our 6 tracks that we're focused on, and then we got recommendations from our work groups on what should this work look like moving forward for the next year or so. We're going to also conduct a listening tour in 2024 to reassess and re-engage with partners and make sure that we're listening to our healthcare organizations. And then we'll do a final report at the end analyzing the work that this Workforce Council did under the grant deliverables. Next slide. This is, oh yeah, that report's done. We'll share it. We can share it out in our follow-up email. So just a kind of high level roadmap for what the next year looks like for HIP. As I mentioned, we're going to be presenting in October at the Association of Occupational Education conference. In December, we'll have another Health Workforce Council quarterly meeting. January, our first progress report is due for the grant, which will be interesting because I don't know what information they want. So we'll see what happens there. And then April through June 2024, we're going to conduct our listening tour, and then we'll spend the summer consolidating all of those findings from the listening tour. And then we hope to host our HIP annual community forum by September 2024, if not earlier. So that's just a quick overview of what the road looks like for us moving forward for the next year. And let's go to next slide, please.
This is a recap of everyone we interviewed in 2022. We had 21 organizations, including HIP, participate in the first listening tour. So thanks to everyone who participated in that one.
And those interviews were all conducted over Zoom. So we'll be moving forward with our second listening tour. That'll be conducted April through June 2024. Actually, let's go back one slide just quickly so people have a chance to review who participated in our listening tour. And the main question is, who should we engage in our next healthcare workforce listening tour? Is there anyone that's missing? Is there an organization that maybe wants to re-engage with us and participate again? Or if there's an organization that we did not include the first round, let us know and we'll include them the second round. So again, feel free to email me if you have any thoughts on that or want to participate. And with that, I think we can we'll move forward 2 slides here. So yeah, we've got time to do some reflections. on anything that you have heard today. If you have any ideas you think would be important to bring back to our work groups, brainstorming any ideas or resources, anything that you would like to share, I just want to open up time for conversation, and feel free to just unmute yourself or share in the chat if you have any comments. We've got a quiet group today. Thank you. Okay, Heather's, yeah, Santa Cruz County Office of Education. We could definitely have you participate in the listening tour. Please email me and we'll connect on that. Well, I guess if no one has any ideas, we're doing our job right. So, but if you come up with anything or you want to engage with us, our goal is to have, each healthcare organization in Santa Cruz County represented by either attending our work group meetings, our monthly meetings, or attending these quarterly online meetings. So please, do continue to engage with us. It helps us with our grant work as well. So the partnerships of the grant really are what help make the grant, I think, get awarded. So we'll go to the next slide. Just open it up if there are any final questions from anybody. Again, feel free to drop questions in the chat. How does the new Cabrillo, I think HCW, are you referring to the community health worker program, differ from existing Cabrillo Human Services program? So the community health worker program is specific to community health workers, whereas the human service program is more focused on behavioral health and career pathways in behavioral health. I apologize, my cat is being very loud. I don't know if you guys can all hear that. Hopefully that's just a really brief explanation of the differences between those two. Jennifer, do you want to weigh in at all? I know you're a little bit more knowledgeable about the programs in allied health.
Can you repeat the question?
The question is just, how does Cabrillo's community health worker program differ from existing human services program? I know that actually doesn't really fall under allied health, but yeah, my understanding is one is much more focused on behavioral health and that transition into behavioral health careers, whereas community health worker is very specific to community health worker training.
Yeah, unfortunately, that's like a different department than mine. Okay. So I don't want to answer on behalf of giving correct information. Yeah.
Okay, good. I'm glad you can't hear my cat. That's just being so loud. Any other questions? And Jennifer, if that doesn't answer your question, feel free to email me and I'll connect you to the program staff at Cabrillo College's Community Health Worker Program. All right, well, if we don't have any other questions, we will move on to our just last few slides of important save the dates.
So save the date, our next Health Workforce Council quarterly meeting will be on Wednesday, December 6th from 11 to 12:30 p.m. If you did not receive the calendar invite, or if you would like to invite someone to join, you can email me at the email posted there. It's mjeresano@hipscc.org. So that way I can send it over to you or anyone you would like to invite. I also want to plug in a reminder that all of our Health Workforce Council quarterly meeting recordings are available on our webpage, and I posted that link earlier, but I'll go ahead and post it again.
Thank you. And then also just a major update. So the Health Career Expo that was planned for to be held in October has been rescheduled. It's now going to be held Friday, November 3rd, 10 to 1 at Cabrillo College's cafeteria. As a reminder, what we heard from our listening tour was employers really wanted an opportunity to engage with youth early on, to share information about the health work, about healthcare organizations and health careers and opportunities in Santa Cruz County. So this event is designed to give employers the chance to interface with high school students across Santa Cruz County that will all be bused into Cabrillo College. And so that they can learn about the opportunities in healthcare careers and opportunities within your organizations. So it's a youth engagement event. It's free to attend, and we if you were already signed up, you should have received a calendar invite for the new date. But if you didn't, please email senior coordinator at yfiob.org. Your Futures Our Business is taking the lead on planning this. HIP and Cabrillo College are sponsors in supporting this, helping engage the allied health programs and healthcare employers across Santa Cruz County. So if you have any questions, you can email senior coordinator, or you can email me and I'll help connect you to YFIOB to get involved in this event. But it has been rescheduled to November 3rd. That's the main update for folks to know about. Okay, we just have 2 more slides and we'll wrap up our meeting. We're going to end early, so I'll give you back ½ hour of your time, which is always nice. Yeah, just a reminder about the work that we're doing. So coming together was the beginning, getting our Health Workforce Council launched. Keeping it together with these monthly work group meetings is the progress, and really the success is all of us working together. And for the next 3 years, we really hope you will continue to engage with us and work with us so that we can make impactful change in Santa Cruz County around our healthcare workforce. So next slide. Just want to say thank you for joining us from our workforce team. As previously mentioned, I'm Haley Mears. I'm the Workforce Development Program Manager. We have Maria Gerizano. She's the program coordinator supporting all of our workforce. And I just want to acknowledge Ali Hayes, who coordinates the IBHAC meetings and has been closely partnering with us on that transition that we mentioned early on about bringing our workforce topics into the fold of the IBHAC convenings. So thank you, Ali, for joining us in our workforce effort. With that, I think we can stop the recording, and thank you all for joining us today.